from our Fox medical team that every single adult needs to hear. A lot of us are putting our lives at risk and we don't even know it. So what exactly are they doing? Dr. Mike filling us in.
So do you know when your last vaccination was?
Yeah, well, I have asthma, so I got a flu shot in the fall.
May 2009.
About 5 years ago.
I think last year, flu shot.
And that's the good news, because according to some health experts, far too many people didn't get a flu shot, or any vaccine for that matter.
I think we think of vaccines as a kid thing to do. I think we don't assume that vaccines are necessary for adults, but that's wrong.
Backwards and proving to be deadly in some cases. An estimated 45,000 Americans reportedly die each year from diseases that could have been prevented by vaccines.
Adults also can suffer and be hospitalized and die from infections, and there are a number of vaccines available for them that can prevent that.
Dr. Paul Offit, chief of the Division of Infectious Diseases at the Children's Hospital of Philadelphia, says there are several reasons why people stop getting vaccinated, namely myths and misinformation.
People think, I got the flu vaccine, but I still got the flu. I got the flu vaccine, but and it gave me the flu. I got the flu vaccine and my whole family got the flu. I don't need the flu vaccine because I never get the flu.
Dr. Whitney Lennon of Thomas Jefferson University Hospital agrees, but says there is one other issue.
Follow-up in doctor's offices can be a problem, and I don't think there's enough awareness out there in the general population that these vaccines exist. So, for example, the flu vaccine is very important. It's now recommended for pretty much every adult once a year.
And that's not all. Doctors also suggest getting a shot to protect you from contracting shingles.
Most of us have had the chickenpox when we're younger, but then as we get older, certain things sort of break down. We can have a shingles outbreak. A lot of people refer to it as shingles. So now the thinking is that all adults over the age of 60 should have a Zostavax, which is going to help boost your immunity and hopefully prevent you from having a shingles outbreak, which can be very painful. It can have some long-term effects.
In addition, doctors recommend adults be routinely vaccinated against whooping cough, hepatitis A and B, and even mumps, measles, and rubella. They also suggest getting a vaccination for pneumococcal pneumonia and human papillomavirus, or HPV, depending on your age. And for those who choose not to be immunized,
so a choice not to get a vaccine is not a risk-free choice. It's a choice to take a different and more serious risk, not only to you or to your child, but also for people who come in contact with you or your child. I mean, these are transmissible diseases. So when people make a choice for themselves not to get a vaccine, they're also making a choice for those who come in contact with them. I don't think that's fair.
Remember, no matter what age you are, you need to stay on top of your immunizations. Get them and stay healthy.